CI650.
Visit your dentist. He is your friend too. And Dental Floss also is here to help you.
Brush, brush, floss, floss. What else do we need to do to make sure our teeth are in good shape?
Your teeth, and brush everywhere, tongue included.
Tongue included. So tell that little child next time they come back on the show to mention about brushing the tongue. Welcome back. It's Boomer Life on CL650. We're talking about your teeth, your smile. We're talking about your hair. We're talking about dental solutions for missing teeth. And our special guest in studio this morning is Dr. Ron Zolka. It's always great to see you.
Thank you, Tom.
I see Dr. Ron every once in a while, and I go home and I brush my teeth all day long, and I think I'm taking the enamel off. There is a right way and a wrong way to brush your teeth, though, isn't there? You shouldn't brush too hard.
A lot depends on the toothpaste,
Really?
the type of brush you have, and then what you do with the brush itself. And it's all about how you use that equipment, because you can. Some people come in and they're missing lots of areas of their mouth, and they say, "Well, I brush every day. I do it 3 times a day." I said, "Well, yeah, and you're missing the same spots regularly 3 times a day."
Oh my God! You guys do have fun down in your office too.
We do actually, and I think that's what comes when you have the experienced personnel that we have in the office, and they're such a friendly group. And what I like about them is they know their job really well, and they're professional, really, really good. And that's nice.
That helps. That really helps. Let me ask you this question: like people I know, they'll come into your office already when you go into any doctor's office, and of course you're nervous, and I'm sure you must see the biggest, strongest guys that are the most nervous in the world.
Yep.
You can tell.
It's true.
Doc, I'm scared. You don't have to tell them, right? You know. So do you do anything to sort of like calm them down just a little bit?
There are a lot of ways. What a lot of people do, and I don't subscribe to it as a routine, is sedate people who are very, very anxious, and sometimes that's very helpful in getting a person. But I think about just a proper communication process, where you're listening intently to the concerns somebody has. And when you start discussing it evenly and recognizing the issues that person has, and maybe they have had a terrible history in their dental experience, maybe traumatic, that they've never really gotten over. Hearing that, understanding it, and putting yourself in their shoes and making that experience as comfortable as possible is really the best way to manage it. You can't tell everybody that what you do is going to be pain-free and without issues, or that you can relax because it's not going to be a problem. They've got to experience that once or twice or 3 times before they become confident enough where they start falling asleep in your chair. But it does happen.
Sorry, what? You've made me comfortable. There are a lot of people out there listening to our show right now, and they're thinking, Dr. Ron Zolka, gee whiz, I know that name. He's probably been around the area for a lot of years, which he has. You've been doing some wonderful work. And somebody who's listening to the show today and they think, I may have some problems in my teeth, but Dr. Ron, I visit my regular dentist every 3 months, so I guess I need him to make a referral for me.
Yes, that's one way to do it. And ask your dentist. If I got an issue, or if it's a complicated issue and you want it dealt with at a higher level, think about a referral, or ask your dentist to consider referring you to BCPerio, or to myself, if you will. The other thing is that if you just want to make that appointment on your own, go right ahead and do so.
So you can do that on your own?
Yes, you can.
So
we don't require a referral slip.
So if I have a regular dentist, but yet I make my own appointment with you on my own, is that not going to ruffle feathers?
I hope not. And our intention is not to have a problem with the dentist that you see on a routine basis, because we don't do general dentistry. And as such, we need the general dentist on side to continue those services that general dentists provide for our patients. And at such time as we finish doing what we are specifically designed to do, then we need that person to continue that relationship with their general dentist. So often we'll work in harmony with it unless you tell us not to.
That was my next question. So you work side by side with the general dentist then?
That's what we try to do.
And you sort of like lay out a plan?
Yep, we'll give them a complete rundown of everything we found and what our thoughts are and what we think is the best direction of treatment. And between often that dentist and the patient, they'll discuss it and determine whether or not it's appropriate to go forward with treatment.
Now, somebody's listening to the program, they're listening to Dr. Ron Zolka today, and they think, hey, this guy sounds pretty good. He sounds like a decent, down-to-earth guy, and he is. Here's what you do. You give him a call. On Monday morning, you'll be at the office, or somebody will be there to take your call, I guess.
That's right.
Of course. 872-0222 is the telephone number in Vancouver, 604-872-0222. Very easy to find, 777 West Broadway at Willow. Lots of parking around. If you live out in the Tri-Cities area, It's 1175 Johnson Street, 1175 Johnson Street. Dr. Zokol is there during the week, and you can get a hold of him at this number, 604-936-8244, 604-936-8244. We briefly touched on this at the beginning of the program today, but let's just suppose somebody just turned the radio on. They just got on the bus, and they haven't heard the story. We were talking about people making a consultation with you down at BCPerio, Dr. Ron Zokol. We've made the appointment. I'm scared as heck. I walk through the front door, I sit down, I'm shaking, and then what happens? Just take me through it.
Well, first of all, you're going to be approached by Shauna, who is my receptionist, and you'll actually probably go to her desk and she'll say, "Hi, how are you?" And start a conversation and get to know you a little bit, take some information about you, and discuss some of the issues you might have to whatever limit you feel comfortable, and you'll then be brought into the area where treatment is provided. The certified dental assistant there will do an X-ray so that I can review what's actually going on at the jaw structure and the tooth structure or lack of tooth structure, and then I'll come in and do a clinical exam, and we will sit and talk. And at the time that we sit and talk, we're gathering information. You're getting information about me, much like I'm getting information about you, because you still don't know whether you want to be treated here or not. Who am I as far as you're concerned? And if I don't sound right and I don't make an awful lot of sense, you're probably right to move onward. But the goal is for me to understand your needs and concerns and priorities.
Now, I know when we come to your office, after we say hello to, what's the lady's name?
Shauna.
After we say hello, Shauna, and she says, "Hello, Tom. How are you feeling?" I'm scared as heck. She sits me down, and the first thing we do, though, is we have to fill out a form.
Yes.
And every time you go to see the dentist or the doctor or goodness knows who, they give you a form to fill out. Why is that so necessary?
Well, it gives us particulars as to who you are. Your age is important. So we'll get your birth date in there. We're also going to get a short medical history to find out things that you might be allergic to or things that have happened, whether you have any systemic illnesses that might be a factor in how we treat you and how we go forward with anything that we do. We get a lot of your background information from there, and it will help us understand what limitations we may have in dentistry. We don't want to complicate your life, your medical life, so we take that information.
So you actually read that over before I actually sit in the chair?
Yes.
Interesting. And then you start your miracles. and by the time the free consultation is over, as you were just saying, you can tell us exactly what area we're going to go through, how we're going to get there, what we're going to do, how much it's going to cost.
Yeah.
Do you want to do it? Do you not want to do it, right?
Yeah, and you're going to tell us what area you're concerned of having treatment. I'm going to tell you whether or not other things affect it that you're not recognizing, and we'll talk about the things that are not only going to yield a result, but it's going to allow you to have a result that's going to last a long time. Because that's another problem, because there are too many situations where people are doing part treatments, because that's what the patient has asked for, but they haven't understood or invited the patient to understand why that might be short-lived. And often patients don't want to make an investment that's short-lived. Sometimes it's better not to make an investment at all than to go into a significant investment that's only going to last a few years, then you have more problems.
What I really like about your place of work down there at BCPerio is that if you come to see Dr. Ron Zokol for a consultation, I think I have to have this tooth taken out, and if I do, that's fine. But if I don't, you're going to tell me too, right?
Oh, absolutely. Our goal is not about teeth. It's about your quality of life. And we help your quality of life because of our expertise with teeth. Therefore, we don't do you any good favors if we aren't considerate of the quality of life you'll have after the work we do. If we can elevate that significantly, keep you healthy, keep you looking good for a long period of time and stable, then we've provided a good service.
So it's all about lifestyle.
In fact,
a good portion.
A good part of it is, and yes, it's nutrition, nutrient-oriented things, so you can eat properly and pre-digest your food with your teeth and get and stay healthy because of the nutrients that you can take in with different types of food, particularly the fibrous foods and foods that are going to be healthy for you. So yes, that's part of it, but not too many people. And some people do come in and say, I want to eat better. Most people come in and say, I don't like the way it looks, or I got pain, or what's this tooth that's missing? But there's the hole in the mouth that's an aesthetic thing. So we're driven by, in most cases, by how we perceive other people see us.
So what people should do right now, if they're listening to us on the radio, is Monday morning, pick up the telephone if they think they may have a problem in their mouth, is to give your office a call. I mean, maybe they don't have a problem in their mouth. Maybe they just bit the side of their mouth. But chances are there could be something else going on in there, right?
Oftentimes there are.
I think so. So the number to call in Vancouver is 604-872-0222. That's 604-872-0222. The address is 777 West Broadway, Suite 501. In Coquitlam in the Tri-Cities, it's number 250, 1175 Johnson Street in Coquitlam. The telephone number there, 604-936-8244. 604-936-8244. You're listening to Boomer Life and Smooth and Easy CL 650 with Dr. Ron Zokol, and we'll be back right after this.
Celebrating the baby boomer lifestyle. This is Boomer Life on CL 650.